Today, federal health officials announced they are investigating a new outbreak involving the diarrhea-causing parasite. No location or source has been identified, but the CDC believes that this cluster includes at least 72 cases of the parasite. They are already seeing cases hit a record across the country in 41 states. More than 11,000 people have now gotten sick. Typically, in any given year, there would be around 3,000 of these cases. Health officials are investigating a cyclospora outbreak that's sickening people across the country, including several cases here in Shelby County. While investigators continue to look for those sources, health experts remind that there are some simple steps you can do to protect yourself. Here's Alicia Renee.
The Shelby County Health Department has confirmed 11 cases of cyclospora. Health officials say 4 people became sick during international travel. Now, 6 others appear to have been exposed while traveling outside of Shelby County, and 1 case remains under investigation. So far, health officials have not identified a local source. As investigators work to pinpoint where infections originated, Deputy Director Keisha Smith-Alexander says the CDC and FDA continue investigating cases reported in multiple states.
The CDC is trying to investigate and find a potential source, but it is traveling all over the United States right now.
Cyclospora is an intestinal illness caused by a microscopic parasite that can contaminate fresh produce through human fecal contamination. Infectious disease specialist Dr. Stephen Thruckle says, unlike many foodborne illnesses, the parasite must mature in the environment before it can infect people. That's one reason why outbreaks are more common during the summer months.
It's a summertime problem. These little parasites get on produce. Because of human waste that is contaminated with this parasite, it matures in the soil and then gets sprayed generally in water, be it irrigation or washing, on any number of types of produce.
Dr. Thruckle says cyclospora isn't typically spread directly from person to person, and for most healthy people, it's more uncomfortable than dangerous. But young children, older adults, and people with weakened immune systems can face a greater risk of complications.
It is not a contagious illness. And the biggest thing that people get into is dehydration. Staying hydrated is by far the most important thing.
Health officials say prevention starts in the kitchen. The Shelby County Health Department also recommends checking FDA recall notices and throwing away any recall produce.
Cooking something to 158 degrees reliably kills that parasite. Rather than buy shredded lettuce, buy an entire head of lettuce, peel off the outer couple of layers, wash it aggressively, and then chop it yourself. Anything that you can peel that fruit.
There will be some corrective actions that CDC and FDA will ask that particular farm to put into play to make sure and guarantee that there are quality checks and this doesn't happen again.
The Shelby County Health Department says none of the 11 local cases have required hospitalization. Officials say anyone experiencing prolonged diarrhea, signs of dehydration, or symptoms lasting more than a few days should contact a healthcare provider. I'm Alicia Renee, ABC 24 News.